Maternal mortality, a true women's health disparity. Every year, more than 700 women die from pregnancy-related complications in the United States, and recent studies show that more than 60% of these deaths could have been prevented. While other countries have managed to drastically decrease their maternal mortality ratios, maternal deaths in the United States are higher now than they have ever been. Although there are many different correlating factors related to these rising numbers, there are two areas in which we should focus our attention towards when determining ways to eliminate preventable pregnancy-related deaths, and those include racial and ethnic disparities in maternal health and increasing maternal age. Did you know that non-Hispanic Black women are 3 to 4 times more likely to die of pregnancy-related complications than any other race in the United States? In fact, according to the CDC, from 2011 to 2014, the pregnancy-related mortality ratio for non-Hispanic Black women was 40.0 per 100,000 live births. And during that same time period, the rate for non-Hispanic white women was 12.4, and for all other races, it was 17.8. Non-Hispanic Black women are more likely to develop complications such as hypertension, diabetes, and obesity, all of which place these women at a higher risk for developing pregnancy-related complications and potentially maternal death. Now let's take a look at recent trends in increasing maternal age. Since 2006, there's been a steady increase in the amount of women giving birth in their 30s. There's been an even greater rise in the number of women giving birth in their mid to late 40s. Just like non-Hispanic Black women, women of increasing maternal age are more likely to have pre-existing conditions such as obesity, hypertensive disorders, and diabetes. According to the CDC, more than 58% of all pregnancy-related deaths result from cardiovascular diseases, cardiomyopathy, hemorrhage, hypertensive disorders of pregnancy, and other medical conditions. Many of these causes are directly related to the risk factors for both non-Hispanic Black women and the aging obstetrics population. So how do we address these health disparities? First, we start by being proactive through identifying and screening these at-risk populations during the preconception period so that associated risk factors can be addressed and patients can be properly referred and treated to prevent potential health problems before they arise. We should also eliminate any and all personal bias related to ethnicity, race, gender, obesity, and any other bias that can affect the way we provide care to our patients. Next, we can focus our efforts on identifying preventable causes of maternal death so that we can develop a plan of action to improve maternal outcomes. All preventable causes of death should be addressed through state maternal mortality review committees and through advocating at the local, state, and national level for fair and equal treatment for all women, regardless of their color or age. Lastly, we should begin by investigating potential areas that impact maternal outcomes such as patient and family factors, provider factors, and systems of care factors. As you can see, all of these are modifiable, and with communication and collaboration occurring at all levels, every one of these can be improved. Moving forward, we should focus our efforts on improving training, increasing access to care, standardizing clinical practice guidelines, improving standards, policies, and procedures, and implementing shared decision-making to improve patient and provider communication. Tackling each one of these will drastically assist in improving the overall outcomes of our maternal population. Just because certain women are predisposed to chronic health conditions such as diabetes, obesity, and cardiovascular disease doesn't mean they shouldn't be able to get pregnant or should avoid becoming pregnant. As healthcare providers, it is our responsibility to ensure that all women are afforded the same opportunity to have healthy pregnancies, safe deliveries, and live to see their children grow up. It's time we move from being one of only 8 countries in the entire world where maternal deaths keep increasing to being an authority and leading the world in eliminating preventable maternal deaths.